Good day, I'm Ilo Ogwanimun, welcoming you to Ask the Doctor. Today is going to be exciting because we'll be looking at issue surrounding women as we take a look at cervical cancer. But before I introduce my guest to you, before we talk more on this, let's go on a short break. More of this when we return. We'll be back.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
Welcome back. If you just joined us, the program is Ask the Doctor, and today we'll be looking at cervical cancer. Our guest today is Dr. Ezike Ebunun. He is a consultant, an obstetrician, and a gynecologist. Dr. Ezike, you're welcome to the program.
It's a pleasure.
Wow.
Good day, viewers.
Okay. So, Doctor, you've heard of the topic that we want to talk about today. So, what is cervical cancer?
Cancer, in the first place, is a malignant growth. Also, we popularly call them tumors. Tumors are abnormal growth, and they can be benign or they can be malignant. When it's malignant, that means it's more sinister. Cervical cancer means the malignant cancer of the cervix. Cervix is, so to say, the mouth of the womb. So if there's an abnormal growth that is malignant, we say the individual has cervical cancer.
So what are the types of cervical cancer?
The cervical cancer can be looked at grossly. Grossly means what we see with the naked eyes. Okay. And then we have the microscopic view that is done by the pathologist, specialist in that area. So that by the pathology we call it histological type. But grossly what you see is that there is a growth, abnormal growth, that is well away from the surface of the tissue. And this one can come out like a cauliflower flower. We call it exophytic. That means exophytic is visual, is fungating, is coming out. So you can look at the vagina, look at the cervix, and you see some exophytic like a cauliflower growth. Very ugly looking, different from the tissues. We say that is exophytic. It can also grossly be the endophytic. Endophytic simply means it grows inward, and then it forms a barrel shape of the cervix. This could be a little bit more difficult to pick out, but the cervix begin to grow inwardly, and then the architecture, so to say, or the texture changes. Then that is the second one. We also have the ulcerative type. Ulcerative type, in that, just as the lay language says, when you look at it, you see multiple areas of lesions, ulcers on the cervix. That shows you that there is something abnormal going on. That is grossly what you see with your naked eye. Microscopically, that's what we look at, because doctors are not satisfied alone. There are many things that could take that format. Could be simple schistosomiasis, TB of this genital tract. So we look at it histologically using the microscope and see what kind of cell is this. In that version, we can now classify it as squamous cell carcinoma or columnar cell carcinoma. Those are not for lay people, but those are yes, medical classification. So you look at it, over 90% are squamous cell carcinoma, because the cells that cover the cervix as the exocervix, the entering of the cervix is squamous cell. So if it occurs, the type of cell they see there is squamous cell. So it's called squamous cell carcinoma. Okay.
This type you're talking about, which of them is more common and which of them are African women prone to? Okay.
You see, I said over 90% are squamous cell carcinoma. And cervical cancer is a leading cause of morbidity and mortality, especially in developing countries, of which we are part of it. And it's the second most common cancer among women, second to breast carcinoma. and it's a leading killer. Over 600,000 people die or new cases have been diagnosed, and morbidity is very high, and mortality is also equally high because of this preventable disease. So carcinoma of the cervix is common in the developing country. Over here in Nigeria, we found out that the cancer of the cervix is the leading cause of death, especially in the northern part of Nigeria. But in the southern part is the second commonest cause of death, second to breast carcinoma. Okay,
so is it hereditary?
Carcinoma of the cervix is more of what we say is a sexually transmitted infection determined. By that I mean it has more of environmental factor. The cause is a virus, human papilloma virus, and this virus is also very common. We have different serotypes, different types of it. Human papilloma virus, essentially the type 16 and 18. These ones are high, we call it high risk type. They are the cause of it. So more largely is infectious.
Okay, so is it hereditary?
The hereditary component is down the line, is very low. So it's more of infective cause. Exposure to human papilloma virus.
Wow. So what are the risk factors of cervical cancer?
Okay, good. So in things like this, we don't talk about the etiology, so to say, because we know that the basic etiology is human papilloma virus, the high grade type. But in cervical cancer, there are a lot of factors or confounding factors that could predispose a woman to having this. And one these factors include the fact that low socioeconomic class. Low socioeconomic class. The reasons obviously known. In low socioeconomic class, they have to survive. And what do? They are more predisposed to being sexually loose, and then having more frequent or rapid exposure to this human papilloma virus, because it's essentially sexually transmitted infection. Then beside that too, we also have, like I said, developing countries, because of poor screening facility that is available, and of course low socioeconomic class is also part of this, giving it a background factor there. Then beside that, sexually transmitted infections that could predispose to exposure to human papilloma virus is a known factor, like other STI. When one is having gonorrhea and other things, there's inflammatory lesions, and these other things could also follow human papilloma virus, and then the stage is set for the viral growth to occur and cause mutations cause abnormal growth. Then beside that too, early sexual debut. When a lady is exposed early to sex, a lady of about 16, less than 16, being exposed to sex, it can cause this. Why? Because there's a type of cell that grows at the top of the cervix. That's the colonal cell. Then below, towards the vagina, there is this squamous cell, and these cells are more rugged, so to say, to stand coitus and sexual interactions and other. So in these ladies, the columnar cell are just in the vagina, and the vagina has a lot of acidity. So when they are exposed to sex early, what happens is that this transformation zone, this area that is undergoing a process we call metaplasia, is developing, begins to be exposed to these mutagens, these human papilloma virus, and so they can imbibe this into their genome, into their DNA, and mutation begins to grow abnormally. So early sexual debut exposure can be a risk factor. So multiple sexual partner too.
So what are the signs or symptoms the ladies need to watch out for?
Well, we'll get to the signs and symptoms, because I'm coming to the nitty-gritty of this real discussion. See, if a lady has multiple sexual partner, is a risk factor. We should not forget that. In as much as we advocate for abstinence and being faithful, we also want them to know that if you are sexually loose, there is the risk of contacting this virus. It's a virus, human papillomavirus, and then the risk of contacting it and getting exposed to it is very high. So multiple sexual polygamy has been a risk factor. Yes. If a woman is married also to a man that is also exposed to other women, that is being faithful, so to say, to unfaithful partner. You're faithful to your partner is not faithful to you, has multiple sexual partners, you are at the risk of contacting it, or is contacting it and then giving the individual that virus and can predispose to it. Smoking is a risk factor. See, these are some of the epidemiological factors. You see, more the ladies that are a little bit loose are at the risk of becoming, because of the peer pressure and the rest, smoking and all that. So imperatively we found out that women that smokes also at the risk of that. Alcoholic are also, the use of drugs, cocaine and all those hard drugs can also be a risk factor. So there are many more, so to say.
Okay. So what are the signs? We've known in courses. What are the signs of cervical cancer?
Yes, the signs are what we elicit from and for. Why symptoms is what the patient tells us. So we come with symptoms first. That is, what does the woman feel she has, or what does she experience, what does she complain of, what are the problems she presents with. Now, this cancer can present in various formats. It can present, for those who are sexually active, as postcoital bleeding. After having sex intercourse, she presents with, there's some bleeding after the penetration. It could be a early presentation. Some have intermenstrual bleeding. In between menses, they begin to experience abnormal bleeding. It could be a problem too, and it could be a way of presenting, showing forth that, look, there's abnormality of the cervix. Beside that too, for women who are in menopause, postmenopausal bleeding, they could experience that. Suddenly, a woman who has stopped bleeding, seeing her period, begins to experience bleeding. These are sinister signs. We should take it very seriously and evaluate the cause of the bleeding. Other symptoms will also include the fact that this woman begin to experience offensive watery vaginal discharge, which some women will mistake for. They think they have sexually infection, so to say, vaginal infections and other things. But offensive, it has a characteristic order in which every experienced gynecologist, the moment we see it coming, even before pelvic examination, you know that this is cervical cancer, so it's characteristic. You cannot miss it. Offensive watery vaginal discharge. Then as the tumor increases, the malignant infiltrates other contagious tissues. It begins to go laterally and downward, upward. It now involves some of the pelvic nerves. You begin to have chronic pain at the back. The woman complains of waist pain and other abnormalities now setting. Then she begins to experience some bladder irritation. She has frequency, urgency of urine and other things, bloody urine. That is what we call hematuria occurs in them. And then sometimes they begin to experience swollen legs. It may be unilateral, that is one of the legs, or bilaterally begin to experience a swollen leg. That is to tell us there is abnormality, there is involvement of the pelvic lymphatic nodes. So those could be some presentation. Then as it metastasizes, as it spreads, she begins to experience more systemic manifestation. She have cough, chronic cough. She may have bone pain, as the case may be. There's a hematemesis. She begins to vomit blood, or hemoptysis. She begins to experience blood, also vomiting and coughing out of blood. All these are some problems, and as time goes on, she begins to experience what we call encephalopathy. She's drowsy, she may go into coma, and these are not very friendly things. And if there is involvement of the liver, she has yellowish eyes and all that. So there are constellations of symptoms. And so now the signs, what we now look at for when this woman presents for checkup, we we want to do simple after the general examination. This woman may be anemic depending on the level of involvement. She die anemic, I mean the shortage of blood when she presents. She may be cachectic. That means she's wasted because of the hypermetabolic state. The cancer is struggling with spreading and struggling, so to say, with the few nutrients available for this woman to consume. So she look emaciated, and then when you go down to look at all that vital signs, maybe okay now. Then if there is lung involvement here, our chest become with a lot of crepitations, there's noise in the chest. The abdomen may not be tender, may not be distended, but when you look at the cervix, you see this type that we've just described. Either it's fungating, an ugly mass, necrotic, very offensive looking, especially when it's stage 3 or 4. You begin to see necrotic tissues that are there. Some is ulcerative, actually with a pungent or a very characteristic smell, and this one will give it out that okay, it's likely to be cervical cancer. Then there may be eroding of this vagina, the tumor is coming down. That is another, that is a higher or advanced stage presentation. Then when you look at these women begin to have contact bleeding with your examining glove, the moment you touch the tumor, there's bleeding, and there's some exclamations there. So this tells us that this is likely to be cervical cancer. So when we take biopsy, we just remove a little cell from that place and subject it to histology. We look at the type of cell. We look at what is happening there. It will be obvious that this is either squamous cell carcinoma of the cervix or adenocarcinoma of the cervix or other types of, it could be lymphoma. So it could also be some other cells. There are different types that we can see, but obviously cervical cancer is characteristic.
The screening you're talking about, or the test you're talking about, does it take long before the result comes out?
No. Maximum 1 to 2 weeks. The test is out, depending on the location where one finds himself. But where there's a pathologist, he looks at it, and the result is out. But its characteristics, there are some basic things that you see, and you know that this is cervical carcinoma.
Is it all medical equipment, all hospitals that can handle such issue, or do they have a specific clinic to handle such issue?
Well, handling may take a different facet, but a basic medical training, any doctor should be able to look at the cervix and say, oh, this is unusual. Even paramedics, you look at it, because the cervix is pinkish, a little bit pale, you see some of these things, good looking. The cervix is good looking. Every basic medical training can afford you the opportunity to look at the cervix. So, but if you look at it again and it's unusual, if you know that something unusual is happening and it calls for referral, simple referral. So
we've known the symptoms and the signs to watch out for. So at what age a lady is prone to cervical cancer?
Good. We have rightly said that these women, early sexual exposure is a risk factor. The women are more prone to it, or it manifests at a later time. It has what we call bimodal mode of presentation. That means at 35 to about 45 years of age, a woman may come up with this, and then it peaks again at the 5th and 6th decade of life. At about 55 to 65, you begin to see resurface again. That's what we call bimodal. However, exposure to the virus may have occurred at earlier age, maybe age 16, 18, 25, when she was sexually very active, and then this virus, she has been exposed to the human papilloma virus, the high-grade type. This virus continues to cause some mutations and growth over the time, what we call cervical intraepithelial neoplasm. Those changes begin to manifest, which can be picked early when we come to screening. But these women, these are very asymptomatic, and they may not be aware of what is happening. So it takes about 10 to 15 years for it to fully mature, and then becomes invasive. Invasive means it begins to erode or breach the epithelium, and then it comes out with what we call cervical cancer. Okay.
So the only time that 15 years is the probation, is it a probation period for cervical cancer?
So to say, about 10 to 15 years is what we call the stage that is for the pre-malignant lesion, before it becomes malignant. There's some changes occurring in the basement membrane of the epithelium, and these changes continue. If picked up early, we can do something and the woman will be free from having cervical cancer.
Well, if you're just joining us, the program is Ask the Doctor, and today we've been looking at cervical cancer. But before we continue on this issue, let's go on a short break. If you have questions, our numbers and email address are showing on your screen. Please don't go away. We'll be back.
ABL.
Welcome back. If you're just joining us, the program is Ask the Doctor, and today we've been looking at cervical cancer. Doctor, do you think women are aware of cervical cancer?
Well, awareness varies from one geopolitical area, or varies from one region to the other, varies from the area you're talking about. In sub-Saharan Africa, because of the level of ignorance and low socioeconomic life we talked about, the awareness may not be as high as in Europe and America. However, there are a couple of women that are aware of this. It's dependent on the socioeconomic class, the educational status quo of these women, and then the exposure, so to say, of these women. So some are aware, largely, but many people are not aware of this yet. We are in a vicinity where people say, that is not my portion, and I jump and all kind of things they say, and God has covered me. Yeah, we still believe that His grace is sufficient for us. But it's like humanity synchronizing with divinity. You still have a role to play. That's why we talk about the screening exercise. So largely, awareness varies from one area to the other.
Okay, like you said some people who said, God forbid, that's not their portion.
Yeah.
Do you think meat have any role to play in this issue?
In this era, we talk about evidence-based practices, evidence-based. Meat generally have been known to cause a lot of controversy when it comes to malignancy and the rest. People talk about radicals and then super oocytes and all that. Well, that is that. But for cervical cancer, research have not shown that is related to meat or beef.
Okay. Research has not shown that it's related to meat, belief.
The research is more on the side of the human papilloma virus.
Okay.
That is the virus that are the high risk or high grade type.
Well, viewers, if you just joined us, the program is Ask the Doctor, and we've been looking at cervical cancer. We have a grand report on how women are aware of cervical cancer. We'll go to the streets. More of this when we return. Don't go over. We'll be back.
ABL.
So, sorry, can you please tell us what you know about cervical cancer?
Yes, I don't know anything about it.
Well, I was just told about it now, and as I already know, it's normal cancer affected by ladies, and besides still, it can be corrected if you are well protected during sexual intercourse.
I just want to know if you know anything about cervical cancer.
I don't know anything about it too.
Okay, you don't know anything about it. I want to know if you know anything about cervical cancer.
No, I don't.
My name is Shola Uweja. Yes, I have heard of cancer generally, and it's something that is an incurable disease.
Have you heard of cervical cancer before?
I've heard about it, but not so much, of course. I know of breast cancer, I know of several other cancers, but not the...
Not much about cervical cancer?
Yes, not much about cervical cancer.
Thank you very much, sir.
Actually, what I heard about it is that when you have sex at an early age, like the age of 15, you are prone to it. At least that's what I know about it.
Have you heard of cervical cancer?
No, I've not heard of it. I can say this is the first time of hearing it. I'm not aware of it.
What do you know about cervical cancer?
I don't know anything concerning cancer.
Cervical cancer?
I don't know.
Think about cervical cancer.
No, I don't know about it.
It is not good for man to live alone in this journey of life. Everyone needs a helpmate. African Broadcasting Network, your trusted partner, your family station.
You are welcome to the most exhilarating program on TV, Mama Helen and You. It's mind-blowing, extremely inspiring, motivating, captivating. It's a moment of fun and entertainment. It is packaged for your upliftment. Embrace your dreams as you keep a date with us on Mama Helen and You, an African Broadcasting Network.
So, doctor, you've heard a lot. You've heard from the public. So, when is it right to do screening for cervical cancer?
The emphasis now is on prevention and not cure of it. Like the popular saying, prevention is better than treatment or cure. And it is on our part to educate the public, like we are doing now, that there is something called cervical cancer, and this lesion has caused the death of so many people, both high rank and file, all over different categories of people, irrespective of their socioeconomic class and their educational status quo. So it is ripe actually that a woman should be educated. It should even be inculcated into the curriculum so that people in schools, so that people know that, okay, these are the things, these are the a girl child of about 18, 21, or whenever she's sexually exposed, she'll have screening, annual screening, or 1 to 2 years or 1 to 3 years, as the case may be, screening for cervical lesions, not cancer this time, so that if there's any precancerous lesions, it can be taken care of. So from the school, from the churches, from the mosque, from jingles and other things that are being carried out to educate women about this, it is pertinent that they know about this lesion, because it can go a long run to preventing it. And like we said, it's a preventable cancer. It's preventable, but sad enough, it's commoner in the developing countries.
But I mean, isn't what you know that you can prevent? What you don't know about, I don't think there's any way you can prevent it.
It's bigger than you. What you don't know is bigger than you.
Because when we went to the street, someone was asking, just screening, what is cervical cancer all about? How can someone screen? People was just shouting. I mean, the lady was surprised to hear of such thing. She hasn't heard of it before. So where can we get the screening?
Programs like this are pertinent, so that people could know this is what is happening. And then we talk about, even in the church places, it's not all about praising and these things are there, but you also temperance and lifestyle modifications and educating our women. There should be time for health reviews, talk in churches, and you tell them all these things. It's not all about, the Lord can do. Yeah, the Lord does everything, but you have a part to play in the plan of redemption too. So to redeem yourself from this kind of problem, you still have a role. And ignorance is likely not an excuse for this. Even the scripture, for those of us that are Christians, say, my people perish for lack of knowledge. So they have to have the knowledge. So churches have the role to play. Even in the mosque, they need to educate them. These people should have some knowledgeable approach to these basic problems. Like this small cell carcinoma, like I talked of, can be very, very aggressive. So you need more radical approach, but the rate of recurrence is very high. It can, depending on the stage, it can be as high as 3 to 5%, and as the case may be, depending on this thing. Generally, it could be being faithful, and then your partners also in turn be faithful to faithfulness, so as to avoid being exposed to this human papilloma virus. Faithfulness, say on the primary prevention. But for those who have had it, there's what we call cervicoscopy. Trying to, down staging, you use cusco speculum. It's a speculum you use in looking at the vagina, which every paramedic can do that. And if we're trained, look at the cervix and see the lesions that may be fungating and the rest, and then we'll care for it early before they become advanced in presentation.